For World Down Syndrome Day 2024, the Down Syndrome International Network is calling for health equity for people with disabilities. Health equity means that everyone has a fair opportunity to be as healthy as possible without being disadvantaged in achieving it. This means that there are no unfair, avoidable, or changeable differences in health outcomes of groups or people. The United Nations have committed to health equity. Article 25 of the United Nations Convention on the Rights of Persons with Disabilities says that persons with disabilities have the right to the enjoyment of the highest attainable standard of health without discrimination on the basis of disability. This means that people with disabilities have the right to health equity. Health equity is also included in the Sustainable Development Goals. Goal 3 is ensure healthy lives and promote well-being for all at all ages. In 2022, the World Health Organization published a global report on health equity for persons with disabilities. This report found that people with disabilities around the world have worse health outcomes than other people. This means they do not have health equity. These outcomes include people with disabilities are more likely to die young than other people. People with disabilities have higher rates of physical and mental health conditions than other people. People with disabilities face more barriers in their environments that limit their day-to-day activities and participation in society than other people. These poor outcomes are especially bad for people with intellectual disabilities. People with Down syndrome are genetically more likely than others to have some health issues. For example, heart problems, thyroid issues, sleep apnea, and even dementia. However, most of the health issues that people with Down syndrome face can be treated or managed. The World Health Organization report highlights some of the causes of poor health outcomes. Structural factors, for example, stigma and discrimination, or inadequate policies and processes. Social factors, for example, living in poverty or transport not being accessible. Risk factors, for example, not being physically active or having a poor diet. Issues with health systems, for example, budget-trained health professionals operate quality health services. So what can be done to improve health outcomes? Improving health outcomes is a responsibility of the government of each country. The World Health Organization report outlines 40 actions that can be taken to improve health outcomes for people with disabilities. For this campaign, we will raise awareness around the world on the right to health equity. We will gather evidence about the health equity of people with Down syndrome around the world. We will advocate for changes in policy and legislation to promote health equity. We will take this campaign to the United Nations for the 13th World Down Syndrome Day Conference on Thursday the 21st of March 2024. Self-advocates, supporters, government and UN officials and NGO representatives will share knowledge, experience and good practice. You are invited to join us in New York or online as we call for health equity for people with disabilities. Please sign up to support our campaign at www.ds-int.org. Thank you for watching.